Most people think cardiovascular disease is just about heart attacks and strokes. However, most people don't know that cardiovascular disease is actually a major driver of memory loss, chronic fatigue, poor healing, and even sexual dysfunction. And a large portion of heart attacks occur in people with normal cholesterol. That's because the real problem isn't cholesterol. It's something far more insidious that's happening inside your blood vessels, often decades before symptoms occur. Now, cardiovascular disease is the #1 cause of death and disability and decline worldwide. Not just for the elderly, but for millions of people who thought they were healthy. Now, if you think that this doesn't apply to you, I challenge you to keep watching, because by the end of this video, you may realize that cardiovascular disease isn't just something that happens to other people or to older people. It could already be happening to you right now. So let's dive in and start talking about cardiovascular disease, or CVD. Now, heart disease is the #1 cause of death by a long shot. It kills 10 times as many people than cancer does. For women, cardiovascular disease is far deadlier than breast cancer by a 10-to-1 margin. For men, it's far deadlier than prostate cancer, again, by more than a 10-to-1 ratio. In spite of that, most women get mammograms and most men get prostate exams, but very few people are getting the best tests for cardiovascular disease. But here's another thing that most people don't realize. Cardiovascular disease isn't just about heart attacks and strokes. It's also the #1 cause of erectile dysfunction in men and sexual arousal disorder in women. Cardiovascular disease is the #2 cause of dementia. We call it vascular dementia. Cardiovascular disease is also a major driver of fatigue, poor healing, and chronic inflammation. In this series, I'm going to break down what cardiovascular disease actually is, what causes cardiovascular disease, and why standard cholesterol tests often miss the mark, and how factors like infection, stress, hormones, autoimmune conditions play a bigger role in cardiovascular disease than you may think. And if you're ready for answers beyond the outdated cholesterol myths, stick around. You won't want to miss this one. Now, at the core of cardiovascular disease is something that most people have never heard of: your endothelial cells. Endothelial cell dysfunction is to cardiovascular disease what neuron loss is to dementia. Just as neurons control brain function, these endothelial cells regulate blood vessel health. So when neurons die, cognitive decline follows. And likewise, when endothelial cells become damaged, arteries stiffen, blood flow worsens, cardiovascular disease develops. Protecting endothelial health is the key to preventing heart attacks and strokes, just like preserving neurons is crucial for preventing dementia. These tiny cells lining your blood vessels control everything from blood flow to inflammation to sexual dysfunction. And when they start to break down, everything from energy levels, brain function, to healing is affected, often decades before a heart attack or stroke. In this first video, we're going to uncover how your endothelial cells work, what causes them to become dysfunctional, and why the real problem isn't just cholesterol. It's damage to these cells, these endothelial cells. So understanding this is the key to preventing heart disease before it ever starts. So let's jump right in. So what are endothelial cells? Well, they're the inner lining of every blood vessel. Whether it's an artery or a vein, the inner lining is made of endothelial cells. So when you look at a picture of it like this, it would be easy to think that the endothelial cells are just a barrier for keeping blood inside a tube. But there's a much bigger story than that. Endothelial cells are actually considered an endocrine organ. Endothelial cells are considered an endocrine organ just like your thyroid, your adrenals, your ovaries, your testes, because they secrete a wide array of hormones and signaling molecules that regulate blood flow and inflammation and clotting and metabolism. And because they secrete these chemicals, the endothelial cells are in control of many, many different functions. For example, they control blood vessel function largely through nitric oxide, a molecule that keeps arteries flexible prevents clotting, and reduces inflammation. When nitric oxide production drops, blood pressure increases, circulation worsens, and inflammation takes hold. The endothelial cells modulate immune function with chemicals like platelet aggregating factor and vascular cell adhesion molecule 1. They control clotting by secreting von Willebrand factor. They control inflammation by making TNF-alpha and interleukin-6. They instigate angiogenesis with vascular endothelial growth factor, or VEGF. They control macronutrient metabolism with chemicals like lipoprotein lipase and endothelial lipase. And they regulate oxidation by making superoxide dismutase and nitric oxide. So my point is, endothelial cells aren't just passive barriers, right? They control a wide array of bodily functions. So if we just take a quick look at two of them, let's start with nitric oxide. So here you can see all the things that nitric oxide does for you. I'm not going to get into all of them for you. You can pause the video and read them if you want. But the point is, when endothelial cells are functioning correctly, you get better energy, better healing, lower blood pressure, better brain and sexual function. So now if we look at vascular endothelial growth factor, or VEGF, this one stimulates blood vessels to branch out and grow into new areas. So imagine you suffered a new injury. If your body couldn't grow new blood vessels into the area, it would never heal. VEGF is stimulated by the endothelial cells to sprout new capillaries, delivering oxygen and nutrients so that it can heal. And the same process is crucial after a heart attack, right? You need new blood flow to help restore damaged heart tissue. VEGF is essential for healing and new blood vessel growth. Now, on the other hand, cancer cells actually exploit this process to support their own survival by stimulating VEGF production. So you can see why endothelial cells are so important, and we're going to expand on this as we go. But the main point that I'm trying to make is that the health of the endothelial cells is absolutely the core of cardiovascular disease. And this paper highlights the point that I'm trying to make. So they included this diagram, which I'm going to modify a bit here, to show that the result of endothelial dysfunction is the things that people typically think of, like atherosclerosis, which is plaque in the arteries, hypertension and stroke, but also increased risk of infection, sexual dysfunction, peripheral arterial disease, which can create pain in the legs, vascular dementia, pain and injury, diabetes, chronic kidney disease, fatigue, and others. Now, another picture from this same study shows how the whole process starts. It starts with inflammation and oxidative stress and other factors that we're going to cover in other videos. But those factors result in damage to the endothelial cells, which results in less nitric oxide production, which leads to hypertension, which further damages the endothelial cells, and ultimately even more inflammation and plaquing and possibly rupture of the plaque. But what happens, right? How does it get this way? Is it high cholesterol? That's it, right? High cholesterol. No, unfortunately, it's not that easy. In fact, a large percentage of people who suffer from heart attacks actually have completely normal cholesterol levels. To answer the question of what causes this demise of endothelial cells, we should look at what's supposed to happen in normal physiology. So in the next video, we're going to take a deep dive as far as how endothelial cells should function under normal conditions and what goes wrong with cardiovascular disease. And if you think heart attacks and cardiovascular disease is just about cholesterol, you're definitely going to want to stick around for this next video.